October is Breast Cancer Awareness Month, but Dignity Health Cancer Institute doesn't want you to wait until October to get a mammogram. Here to talk about how important it is for both men and women to get checked is Dr. Lise Winton Lee. How are you doing, doctor?
I'm great. How are you?
So let's talk about this because everybody knows when October rolls around, we start talking about Breast Cancer Awareness Month, but really that's not the time for people to get checked, is it?
Well, it is a great reminder to everyone as Pink, covers our televisions and our hallways that a screening mammogram is very important. But it's important that women get a screening mammogram once a year. And if everyone tries to get their screening mammogram in October, there's a lot of wait times. Yeah. So I usually encourage women to get their screening mammogram in the month of their birthday as a good reminder. But the truth is, as long as you're getting a mammogram once a year, it doesn't matter what time of year you get that.
Yeah. Okay, there's two types of course, mammogram and screening. Let's talk about the different ones there.
Yeah, so screening mammograms are intended for women who are walking around and feel otherwise healthy. They have no breast complaints and nothing that they suspect going on in their bodies, and they simply walk off the streets into a screening mammogram center and get pictures taken to ensure that there's nothing hiding in their breast that they wouldn't otherwise detect. There's also something called a diagnostic mammogram. It's very similar in the sense that it's the same type of picture, but those are done for women who have a complaint, and those are also done for men. So anyone who has a lump or a bump where a lump or a bump doesn't belong, or who has new changes to their breast like dimpling or nipple inversion, leaking from their nipple perhaps, those are all reasons to get a diagnostic mammogram and speak to your doctor.
Yeah, I think people kind of like just get discouraged from them because people talk about how bad they are or how they hurt and stuff, but with new technology, new things going on, they shouldn't be afraid, but also don't let that discourage you to getting it done, am I right?
Absolutely. I mean, I think that there is a little bit of discomfort in a mammogram, right? You're being squashed a bit like a pancake. But screening mammograms are extremely effective at catching early breast cancers, and they truly do save lives. And so a few minutes of discomfort to me is worth the trouble, essentially. And I am obviously quite biased because I take care of breast cancer patients all day, every day. Yeah. But I think a screening mammogram is definitely something worthwhile for all women.
And what ages should they start looking at both of these kind of screenings? Because I know they say as you get older, but we're seeing some, of course, breast cancer in younger people at times.
So as a general rule of thumb, I tell all of my referring providers and the medical community that women truly need to be screened for their breast cancer risk at about age 25. And what I mean by that is that every single woman walks around the world with a different risk. What plays into that risk is the amount of estrogen exposure a woman's had in her lifetime, things like family history of breast cancer, ovarian cancer, pancreatic cancer, the potential for underlying genetic mutations, and also a personal history of something going awry in your breast, so breast atypia on a biopsy perhaps. And so at 25, I recommend that their risk be calculated. Anyone over a 20% risk of breast cancer truly needs to have increased surveillance and generally might start at a younger age. But for the average risk woman, breast cancer screening starts at age 40 and is done annually until a woman is basically, as long as they're in good health. So there is no age limit to screening mammography.
Yeah. And with men, kind of like the same thing, kind of like to look at, or is it a little different?
So with men, outside of men who have a known genetic mutation, we do not recommend screening mammograms be done. But it's still important for men to remember that anytime they have a lump or a bump where it doesn't belong on their breast, they need to talk to their doctor. Because men do develop breast cancer, and those breast cancers can be treated, but men tend to procrastinate because it's not a common diagnosis in men, and tends to be a little bit of a male characteristic at baseline.
Yeah. So one thing I also love about Dignity Health and of course the Cancer Institute is that you guys serve the community in a lot of ways, especially some low-income communities too, which are so important to you.
Yeah, so the Dignity Health Cancer Institute is located right downtown Phoenix at 6th Street in Fillmore. And we serve the greater Phoenix community. But one thing that's really important to me and why I came to work at Dignity Health is that we offer cutting-edge cancer treatments to patients with private insurance, but we also have a great charity care program that offers the exact same care regardless of your insurance status or ability to pay. And to me, that's incredibly important and allows us to do outreach in our community because in 2023, in Phoenix, Arizona, no one should be dying from completely curable breast cancer.
Yeah. Doctor, this is so important right now, as we mentioned, not to wait for October, but you said it right there, maybe your birthday, and other different times, so that way you can get in and get it done. So
Yeah.
thank you very much.
You're
and we have
very welcome.
information on the screen right there where you can find out more about Dignity Health Cancer Institute and, of course, getting checked for breast cancer and other things that they do. So thank you, doctor.
Thanks for having me.
Perfect.